All right, welcome back everyone. I'm Dr. Rao and from Pain and Spine Specialists, and we're going to start talking about some lower back pain conditions. The first one that comes to mind, probably the most common one, is something called sciatica. Sciatica is when the sciatic nerve, which is a combination of several nerves in the lower back, when that nerve gets compressed and inflamed, it can give you back pain, numbness and tingling in the leg, as well as leg pain and even weakness. When that disc starts to bulge back, you get compression or irritation and or inflammation of the spinal nerve as it exits the spine. That nerve gets irritated and inflamed, and the brain will feel pain, numbness, tingling, and even weakness. What can we do about it? Well, we can first start with physical therapy. We can try to increase strength in our core and our lower back muscles. See if that takes some of the strain off of the lumbar spine or the lower back itself. In our lower back, we have bones, we have discs, and we have spinal nerves. We also have joints on the sides of the spine. Now, all of these structures could potentially contribute to these symptoms. If physical therapy does not give us the type of relief we need, as well as the functional improvement, then we can consider injection therapy. Injection therapy for sciatica specifically would be using an epidural steroid injection to decrease the swelling and inflammation around those nerves. We would place a small needle that goes right where the nerve is exiting the spine, and we would inject steroid, which would be the key ingredient to decrease the swelling and inflammation. The steroid can kick in about 7 days, and it's safe to do about 3 injections in a span of 6 months. Our goal is to do the bare minimum. We want to get you feeling better and get you more functional with the least amount of interventions. If that does not help, then we can consider other sources of where that pain is coming from. Most people have a combination of several different things that are happening at the same time. It could be a combination of sciatica, which is coming from a disc that's herniating back, or a disc that's bulging back, protruding back, or even extruded out. All of these are fancy words for disc problems that can irritate that spinal nerve. So if the epidural steroid injection does not provide adequate relief, or if it gives you some relief, it helps you with your leg pain, but your back is still causing you discomfort, then it could be that the residual or the leftover pain is coming from these joints on the sides of the spine called facet joints. Those joints can become arthritic, inflamed, and cause for muscle spasm and pain. For that, we can use something called radiofrequency ablation to treat those nerves, to get rid of those nerves, and hopefully get you feeling better. Those nerves can regenerate. They can come back in about 6 months to a couple of years. And if you feel that pain coming back again, then we can treat that again. We can also use neuromodulation or spinal cord stimulation, where we place electrodes into the epidural space in the back to block pain from the back and the legs from going to the brain. Spinal cord stimulation has been around for about 60 years. And the nice thing about it is that we get to do a trial, which is a test drive, before we actually implant the device. It's almost like a pacemaker for the spine. We also have the ability to use peripheral nerve stimulation, which is blocking and modulating these nerves that supply the shoulder, the hip and the back, or the knee. And by modulating it, we're trying to block pain, get people to be more effective or be more functional, and get the pain relief to be more effective. If that gives you good relief on a trial, then we can go ahead and implant the device.